Okay, welcome to the other side of medicine, everyone. I am Dr. James Krystosik, and we are glad that you're spending time with us this evening here on the other side of medicine. All you students of natural health care, you students get ready because tonight we have a really special program for you. We are going to be talking about the miraculous healing properties of Manuka honey. If you've never heard about Manuka honey before, it is not an ordinary honey. It is an extraordinary honey. And we have two special guests with us. We have Mike Everly and we have Sean Seal from Bees and Trees, a company that is located in Connecticut, and they have beehives in New Zealand. They'll tell you all about it. So without further ado, we're going to get introduced to these two people. Mike and Sean, welcome to the other side of medicine.
Thanks very much. Really glad to be here.
Well, I tell you what, I read an article that you guys wrote about Manuka honey and the various types of ways that it's rated. And I was really impressed by that article and I was intrigued. So I contacted Sean and here we are. And I really believe that you guys have something very special to offer people. And I really like your philosophy, the way you approach the business and how you help people with this Manuka honey. I really believe you have a heart for people. And I believe that your care and your consideration in preparing Manuka honey is done the right way. And I think people need to learn about this company. So thank you for being on the program. And I think people are going to really be surprised about how this miraculous food, this superfood, here on the other side of medicine, we love superfoods. And this truly is one remarkable superfood. So, Mike, if you could start us off by telling what is Manuka honey?
So Manuka honey is honey produced by bees foraging on the nectar of the native New Zealand Manuka tree. So it's a flowering Manuka tree, a flowering tree. It's native to New Zealand, grows predominantly in New Zealand, and it's a regular honeybee foraging on this native plant that's in very remote parts of New Zealand that produces this very special honey, Manuka honey.
So, I know that a lot of our listening audience knows about the tree you're talking about. That's a tea tree, right?
It's in the tea tree family, but it's a very specific type of tea tree, the
So it's
Manuka
it's
tree.
it, but it's not the tea tree that we use for medicinal purposes.
Um, I would say it's definitely in that family, and it there certainly could be tea tree oils derived from Manuka, but there could also be tea tree oils derived from some similar species that are grown in both New Zealand and Australia.
I'm just wondering if the antimicrobial properties and the antiviral properties. I know that tea tree oil has those properties. I'm just wondering if the pollen that the bees collect might have something to do with that particular property of the tea tree oil that comes from that plant. I'm just wondering, have you done any investigation in that?
We haven't actually tried to look into the linkage between tea tree oils and Manuka honey. And with Manuka, the bees are actually they're foraging on the nectar. Actually not collecting the pollen of the Manuka tree predominantly when
Okay, let's talk about the difference between those two, the nectar and the pollen.
right, right. So nectar is the sugar-based substance that bees collect. It's their carbohydrate fuel source. Pollen is the protein-based food source that bees collect, and they can get their pollen and their nectar from different species. And pollen from Manuka trees are especially hard for bees to forage, and as a result, they tend to forage on other pollen types while they're foraging on Manuka trees, which is one of the reasons why the last thing you would want to use as a indicator of how pure your Manuka honey is the pollen count in the honey. That's a very poor indication. in the case of Manuka honey. But there's a lot of testing that gets done. There's very specific chemical markers that are looked at for Manuka honey that help determine its purity and its related potency as a wellness product, as a healing product. And we could talk more about those
Sure,
specific
sure,
measures.
sure.
Yeah.
Well, talking about bees, I just want to take a little diversion here and talk about the bees for a minute. We live here in Ohio, and I sit back in my patio garden, and we've got just multiplicity of flowers and bushes and all kinds of wonderful, um, you know, beautiful flowers. And yet, I go outside, and pretty much the whole spring and summer, I've only seen one or two bees.
Hmm.
So we have a problem, don't we, with the bee population? Could you kind of talk about the seriousness of that just for a minute?
Yeah, yeah. There's a real big problem worldwide with honeybee populations. The phenomena that started getting a lot of attention probably 15 years ago in the U.S. Was termed colony collapse disorder, and there still continues to be differences of opinion and research going on trying to fully understand that phenomena. But the general accepted within the kind of beekeeping community, scientific community, is that it's a combination of stresses that we're putting on the colonies. Some of it's our monoculture farming practices, where we, tend to have our bees in just one type of crop for pollination, or mostly for pollination here in the U.S. And then it's the long distances that our bees travel. Something like 80 or 85% of the U.S. Bee colonies go to Southern California every January for the almond crop. And that creates a lot of stress through that travel and through the hives being congregated in really large areas before they're dispersed. So there's an opportunity to spread disease. And then there's a particular type of parasitic mite called the Varroa mite that is a worldwide issue for bee colonies, and they carry viruses. And so these viruses, the Varroa is a vector for that virus. The viruses are spread with all this mixing of hives, and it's a terribly tough environment for these bee colonies to really be healthy, to thrive, to survive. So that's kind of a quick picture of
Sure.
beekeeping in the U.S. today. In New Zealand, I'd say we are not yet experiencing those kinds of stresses on our bee colonies. In our case, the bees that we manage, we don't do any pollination with them. They only get moved twice a year, and those moves are like an hour by truck, or 2 hours by truck. They're not 3 days by truck to go across the country, and that's just to move them from their overwintering sites into these remote areas so that they can capture the Manuka nectar. But super big challenge. We should all be concerned about the bees, and yeah, backyard beekeeping and hobbyist beekeeping is a great way for anyone to help in a really small way, but important and meaningful way, to bring more bees back into our communities.
Sure. Well, I'm certain that the chemicals that are used in farming and the pollution that we experience in our
Yeah.
environment, I'm sure
Hmm.
that's contributing to the disease of the bees as well, and the weakened, part of their immune system, however that works. So I'm not sure, but I'm sure that they have some type of immune system that they need to keep everything in their hive healthy. But as a kid, I mean, I saw bees everywhere during the summer, and it's just
Hmm.
like there hardly. I saw one bee. But anyways, let's move away from that right now, and let's continue talking about Manuka. You said New Zealand. It comes from New Zealand. That's the primary place that it's raised. Uh, how is it different from other types of honey?
Yeah, so I can kind of tell the story of the discovery of Manuka honey, and that'll kind of explain it. In the early 1990s, a researcher in New Zealand was looking at the antibacterial properties of a whole bunch of honey samples. And most honey is known all the way going back to the Bible and ancient times to have antiseptic properties. And those properties are a result of a substance called glucose oxidase that when it comes in contact with moisture, like moisture on your skin, it produces hydrogen peroxide. Same hydrogen peroxide we go to the pharmacy and purchase. So that's considered hydrogen peroxide activity, and it's short-lived. It dissipates with exposure to heat, light, and dilution. So it's useful, but it has its limits. And this researcher was using a catalyst to neutralize the effect of peroxide activity in these honeys. And there was one sample that still showed strong resistance to bacteria, and he didn't understand why. And
So in other words, for our listening audience's benefit, when you say
yeah,
neutralize, so they isolated the factors so that they weren't looking at the hydrogen peroxide activity, they were looking at something else.
exactly. So, and it was the Manuka sample that had this other property, and the researcher, Dr. Peter Molin, coined the term non-peroxide activity for this special property, which later was kind of turned into unique Manuka factor for marketing purposes. So it wasn't until 2007 or 2008, so maybe 15 years later, that researchers in Germany discovered that the organic compound in Manuka honey that correlated most directly with these antibacterial properties was methylglyoxal, abbreviated Mg or MgO. So that's become the standard by which all Manuka honey is tested when it's produced. In New Zealand, it's the indicator that most directly determines the value of the honey when it's traded between a producer and a packer, somebody who's going to put it in a jar and put a label on it. But it was those antibacterial properties. They were very very robust, very broad spectrum. You know, Peter Molin kept going with his research. They threw every bacteria at Manuka honey that they could get samples of, and it kept showing this really potent antibacterial property. And so that was the origin, and still forms probably the center of the research body of knowledge. But researchers have since gone out and studied antiviral properties.
Well, before you
And
move before you move into the
sure.
antiviral, I just want to make a comment that, and I'm certain that you have studied this a lot, that the Manuka honey has the ability to kill antibiotic resistant strains of bacteria. And
Yeah,
we're really in a quandary today that there's only a few antibiotics that can kill off these very virulent bacteria. And, you know, in hospitals, there's some pretty dangerous bacteria there. And doctors are worried there's not going to be enough antibiotics to be able to take care of it. And people are dying because there's no antibiotics to treat some of these bacteria. And it's really interesting. In my research, I've discovered that many of these bacteria now have developed an ability to literally eat the antibiotics and grow stronger by eating the antibiotics. Have you ever heard of that?
I have not specifically heard of that,
Yeah,
but
well, there's research to
yeah,
prove that,
yeah,
and it's
yeah,
pretty
yeah.
serious.
Hmm.
We're getting so much antibiotics in our food supply, and people don't, you know, they say, well, I don't use antibiotics, but yeah, you're getting it in your food supply, and small amounts, but it's constant, and it's building up these resistant bacteria inside of our bodies. So Manuka is able to kill off all these various strains, and it's not antibiotic resistant. It's literally, it kills off all bacteria.
Yeah, yeah, no, that's an excellent point you bring up. And as I've read, and I've read most of them, the scientific and medical research papers that come out on Manuka honey in the abstract, when they're talking about the study they're doing and why they're looking at something like Manuka honey, so many times they're quoting this issue of antibacterial or antibiotic resistant bacteria, and we need something that can step in and help us, fill this void because we can't keep up with how fast the bacteria are mutating to overcome. We can't create antibiotics in the labs quickly enough to stay ahead of the bacteria, but Manuka honey seems to be effective in a lot of these cases, which is tremendously
Well, the
encouraging.
research, all the
Yeah.
research that I've read, Mike, says that there's no bacteria that's resistant to Manuka honey.
I know of none. There's one particular paper that's like a study of studies, and it's got in the appendix, just lists. It's like 4 pages of bacteria. You having a medical and scientific background would probably recognize many of those bacteria, but they're each one of them's a mouthful. But yeah, and they show the different studies that were done against each of these viral strain bacterial strains. Excuse me.
Hmm.
Yeah.
Okay.
So
Oh,
pretty
sorry to
incredible.
go to
Pretty
sidetrack,
incredible.
but
No,
continue
no.
on with what you're saying about the viral, antiviral capacity of it.
Yeah. So there's been research done on antiviral effects of Manuka honey. There's been research done on anti-inflammatory and antioxidant properties in Manuka honey. There's some limited research on antiparasitic and antifungal properties. Some of the kind of furthest out, if you will, in terms of getting into some kind of interesting use cases is getting into looking at Manuka honey's ability to affect certain cancer lines. So there's been studies done on cancer cell lines with Manuka honey, both on its own and in combination with chemotherapy drugs, and to some really interesting and encouraging results. So yeah, and it's great because I'm often on the National Institute of Health's PubMed database and putting in the search term Manuka honey and seeing what's the latest. Right now, when you put that search term in, you get 569, responses or findings. And I tell people, as soon as I've quoted you that number, if you try this next week, it'll be more than that.
Hmm.
Because there's literally, in the last 5 years, there's been an average of 55 studies published papers per year. So literally more than one a week, where another research team in some other part of the world has delved into Manuka honey in some capacity. It could be for wound healing. It could be for there's all kinds of different research going on. But yeah, it's all
It
very,
also it
very
also helps
interesting.
it also helps
Yeah,
with pain. If I understand, it helps to reduce pain as well because you're reducing the inflammation, obviously.
yes, it
But
reduces the inflammation. Yeah.
so
Hmm.
that's really a pretty profound effect because a lot of people, especially I know that there's hospitals that use Manuka honey for burn units,
Hmm.
so that to make sure that people don't get infected and keep it moist and all that good stuff, and so there's a really robust amount of use of Manuka honey. Now you mentioned antiviral, so when people have a cold or the flu, do you find that there's research to show that it's efficacious for sore throats or for reducing the duration of colds or flus? Is there any research on that?
So I've not come across any research yet with where they've done like clinical trial type studies with patients. I think the variability in a cold and how quickly you catch it and that sort of thing makes that difficult. I've got tons of anecdotal evidence from customers that have written kind of testimonial reviews on what a great result they've had. I can tell you from personal experience, if I feel that first little tickle in my throat, realize, hey, I sneezed earlier today. Gosh, by tomorrow, I might have something coming on. If I hit a couple of teaspoons right away per day with the Manuka honey, 9 times out of 10, I'll knock it right out of my system, never even get the cold. 1 out of 10, I'll get that cold, but it'll be milder symptoms and it'll cycle through me a lot quicker. And I've had that experience. Sean and his family have had that experience. Sean turned me on to the use of Manuka honey with a saline solution for irrigating your sinuses. If you've got a sinus infection, or you've got a cold moving up into your head, and so using like a neti pot or a nasaline syringe, I've had great results, and know a lot of people have had great results with that approach as well. So it's super helpful and useful. It helps with symptom relief. A little half teaspoon of honey at night, when you lay in bed and you might want to start coughing because of that postnasal drip, the honey can really soothe the throat, really help with symptom relief. But it's also, from all the science, that it's attacking that underlying bacterial infection or that underlying viral infection.
Yeah,
And yeah.
I've seen some research studies. They did on about 300 people that they did these solutions with um, saline and Manuka nasal sprays, and
Mhm.
they saw significant results in helping to reduce sinus infections, the
Right.
incidence of sinus infections and the symptoms, and they cleared up a lot quicker. So that's pretty neat that you can use. Again, we're talking about using food as medicine. I just absolutely
Right.
love that we can use food as medicine, and this is something that people need to learn more about. That there are superfoods like Manuka, and there's so many other ones out there that when you start to get symptoms, you could take these things safely without any side effects. As a matter of fact,
Right.
they'll have beneficial effects. Whereas when you take a medication, every medication has a side effect or multiple side effects. Some of them are scary. Um, Interestingly enough, my wife works in the medical field as well, and she's an EFTA. It's an extended dental function assistant, and she does the fillings. The doctor drills the holes, gets the cavities out. She comes behind the doctor and puts in the composite, and she drills all the anatomy. And so she's in an environment where there's a lot of bacteria flying around, and she had a cut that she ended up getting an infection on her leg, and it turned into cellulitis. She was really stressed out, and when you're stressed, your immune system depleted, and so she was susceptible to this infection. And it was a pretty nasty bacteria that normally is not found on the skin. It was Pseudomonas. Normally you find that in the lungs of people who get pneumonia. Well, anyways, this was on her skin. And, we used not only Manuka honey, we used a plethora of other foods as medicines, both
Mhm.
internally and externally, including oregano oil and astragalus extract and propolis
Mhm.
from bees internally,
Mhm.
and all these things are food, and it was able to heal her very, very serious infection on her leg. And it's amazing that food, as Hippocrates said, is the best medicine. I think more and more people are
Right.
beginning to realize that. So when we're talking about Manuka honey here, folks, this is a superfood that you want to learn more about, and you can use it in your kitchen for purposes of healing your body preventatively and using it medicinally for some common ailments. And, you can use it in tandem if you're taking medications as well, because they found that using it in tandem with antibiotics expedites the healing process if that's what you're prone to do. My family and I, we don't want to use antibiotics unless they're absolutely necessary, and
Mhm.
so we use the natural things and not rely on the antibiotics. So this is what we're talking about here on this program. A very, very beneficial food, Manuka honey. And these two gentlemen have a lot of information to share with us. So we're so thankful you're on the other side of medicine with us, guys. Sean, I'd like to have you chime in here and give us a little bit of uh, additional information to segue what Mike has been sharing with us.
Well, I'll say, we get a lot of input from our customers in terms of how they're using the product, and it's really gratifying. A lot of times, we feel like we're out here laboring in obscurity, and then we get, these unsolicited calls or emails from people just really thanking us for what we're doing, which is, of course, uplifting and encouraging to us. Everything from external wound care, which is, I would say, the very common, kind of, and people are always surprised, like the result that they get from using Manuka honey instead of, more traditional antibacterial. Just really amazing speed of healing and lack of scarring in many cases. And we've seen some pretty, unbelievable before and after photos, that people were kind enough to submit. We're also seeing a lot of customers use it for, the big one, I guess, is digestive health. A lot of people struggling with acid reflux and GERD and Barrett's esophagus. And it's certainly, not universally helpful for that, but by far the great majority of customers who are using it get some benefit in terms of helping them with their management of that.
There's a lot of Americans suffering with esophageal reflux. There's no question about it. And it's really interesting because right on the doctor's labels for prescribing that, it says don't use more than 6 to 8 weeks. And I know people that are on it for years and years, and they're setting themselves up for disaster because when you do that, when you take medications like that, you end up propagating harmful microorganisms like C. difficile, and which is very dangerous. It can be deadly. I think around 50,000 people die a year from C. difficile bacteria infections. And so when you're taking medications like that, whether it's antibiotics or these antacid medications, you're really setting yourself up for disaster. You could use something as simple as this Manuka honey to be able to get relief. Again, food is the best medicine. So I know that Sean, that people will use this for healing ulcers. That's another benefit, and then there's some research for that as well, and diabetic ulcers for sure. Question I wanted to ask you guys. This is really something because we got to be careful. If somebody is a diabetic, they don't certainly want to start taking spoonfuls of Manuka honey, right?
Yeah, so a teaspoon of our honey, which is a 7-gram teaspoon. We always tell people it's like a baking teaspoon, not the kitchen teaspoon that dig out there. But a 7-gram teaspoon of the honey has 6 grams of sugar in it. So it's not, in the context of even diabetic individuals, that's a pretty modest amount of sugar. And even if you're having half a teaspoon daily, 3 grams of sugar, you can get some good kind of digestive and immune system health from that.
Well, one of the things people can do, again, they need to talk to their doctor about using it, but they can take and use common sense. Again, that's what the other side of medicine is all about: common sense, science, and cooperation with nature. If you take something like Manuka honey and you eat it with some whole grains, you're going to have the fiber in the whole grains, or you take it with a prebiotic like inulin or some other prebiotic, you're going to slow down the absorption of that sugar and you're not going to have a problem. And that's going to make it a lot more efficacious, and it's not going to raise your blood sugar levels that quickly because the fiber is going to slow that absorption down. So you can use these foods again to complement the sugar that's found in Manuka honey. So let's talk a little bit more about Okay, you mentioned most people get benefit from their acid reflux. I know we talked earlier, Sean. You said somewhere around 80%. And we're not going to tie you down to a percent, but that's a significant amount of people who get either a cure or a dramatic relief from taking Manuka honey on a regular basis. Now, the question is that going to heal it, or is it going to, in other words, you're going to have to take Manuka honey for the rest of your life, or does it actually heal it?
Yeah, I really don't know, frankly. I mean, we're certainly not medical professionals, Mike and I. Um, I, I think we see more instances of complete healing with like H. pylori bacteria and stomach ulcer, for example. We'll just, get people responding to us that it's like, I've been trying to get rid of this for years, and finally, using Manuka honey for 3 months, I've gotten rid of it.
You mentioned H. pylori. There's research to show that Manuka does kill H. pylori. So that's really science. Again, people's experience, but the science is there as well.
Right.
Oh, and by the way, before I forget, I really found this is really interesting. Back in 2007, the United States Federal Drug Administration sanctioned using Manuka honey as an antibiotic alternative. Did you know that? That's pretty
Yeah,
amazing.
I knew that it had been approved for wound care uses by the FDA, and I normally would say that the mainstream medicine has embraced it as a wound care product, and FDA has approved it. I think CVS even has a line of bandages that are infused with Manuka honey. So yeah, it has gotten some official sanctioning in certain uses and certain applications like that. But Sean's right. The kinds of feedback we're getting from customers on their acid reflux, and it is a high percentage of them. I mean, I see words like miraculous, life changing. Wish I had found this years ago. I'm reducing my meds. I'm getting off my meds. These are kind of the recurring themes that I'm seeing. You raise a great question. Would you need to continue to consume the Manuka honey, or would it actually heal it? I don't know what the root cause necessarily of acid reflux is. If
Oh,
you are
there's
making
multiple. There's
other,
multiple. There's
yeah,
multiple
yeah,
causes. Yeah, there's
yeah,
multiple
yeah,
causes.
yeah,
Yeah.
yeah.
So that's a can of worms we're opening up there. But if you're getting
Okay.
the relief and you don't have to take the medication, and you're taking something that has so many beneficial properties to protect your body from pathogenic microorganisms,
Hmm.
that's extraordinary. So again, we're talking about food, folks. Food is medicine, and the Manuka honey is a superfood. So let's talk a little bit about the differences in the qualities of the Manuka honeys that are out there, because that's one of the things that really intrigued me about your company, that really drew me into it, because you guys really go to great lengths to make sure you have the highest quality.
Yeah, yeah. So that's a super important point. And as an industry, the Manuka honey industry does not do a good job making it easy for consumers. I'd say that we're guilty as an industry of creating confusion, and in some cases being intentionally misleading by some unscrupulous companies. So the way to know that you're getting a high quality Manuka honey is to specifically look for the amount of methylglyoxal that's in the honey. It's a concentration, it's milligrams per kilogram. So by way of example, we sell a 350 plus Manuka honey, a 550 plus, and an 830 plus. And we consider that our mid activity, our high activity, and our kind of our ultra high activity Manuka
Well,
honey.
let me just pause you for a second there, Mike, if I may. The compound you're talking about is a uh, we call these phytochemicals, is what we call them, that are found in plants. They're found in the honey. These are phytochemicals, and many of these are what we call phenolic phytochem. They're phenolic compounds, And these
Right.
are very potent antioxidant and other medicinal properties that they have. So this is the compound you're talking about, and so it's the mg rating that we're talking about right now that should be on the label.
Right, that's exactly right. So you want to find that on the label. If you don't see that on the label, if you see there's an equivalency scale that I mentioned earlier, unique Manuka factor. So UMF rating is a lookup value in a table against the MG test result. So if you find, for example, a UMF 15, that's the equivalent of an MG 530 milligrams per kilogram. So a UMF is a valid rating. You can trust that. I would say if you're looking on the UMF scale, make sure you're getting a 12 or more. So 12, 15, 20. If you're looking on the MG scale, get at least a 250. 250, we do a 350, 550, 830. And you won't
Yeah, so
find much
those got to
above
be
the
right on the
830.
label. They got to be right
Should
on the
be should be
label.
right in the label. The big red flags are when you see a generic word like bioactive 15 plus or active 15 plus or some kind of factor, and these are companies making up their own proprietary scale, and they're basically trying to mimic the UMF scale, and what they're putting in the jar is a very low mg honey, typically 100 or less, and they're trying to pass it off as something that's going to give you a higher medicinal value than it really will. And unfortunately, the grocery buyers, the big box retailers, they fall prey to this. And I would say 80% of the Manuka honey in the U.S. market, and maybe a little exaggeration, is this very low quality and oftentimes misleadingly labeled honey. And you'd find it at retailers that you think would have done their homework and should know better.
Well,
So,
I'm going to
yeah,
pause you there because I have a friend that's a functional medicine practitioner. I was telling Sean, and she is a coordinator for a chain of grocery stores that has a wellness department, and they have vitamin supplements, and they got Manuka honey, and they are using one of the products that you guys had written about in an article that doesn't have the MG or the UMF rating on it, and it's a bogus company, and yet they're using this and selling it at an expensive rate of the cost is outrageous for it. So really, people need to be aware that this is a real problem, and they want to get the real thing. You got to go to the real source. And one of the things I like about your guys' company is that you guys really are not trying to become a big conglomerate. You're trying to service people at the best and the highest quality, and I love that approach. And so, why is Manuka honey so expensive, though?
yeah. So it's so expensive because it is rare and hard to produce. So I alluded to these remote areas of New Zealand that we've got to get into. Oftentimes the hives are being flown by helicopter into these remote areas for the production. So it's logistically complex and expensive. And as the worldwide market and demand has grown for it, it has created competition, which has pushed up the price of everything related to the production, including the access to the land where the Manuka trees are growing, the amount of money we have to pay to landowners to get access to their land, to move the hives in for the Manuka production. So it is an expensive product, and I'm really glad you made that point about brands that are not kind of being true to label and being transparent, because there's two real crimes going on there. There's somebody being kind of robbed of their hard-earned money, paying too much for an inferior product. But I worry even more about that person that's suffering from maybe acid reflux, that reads something about Manuka honey, wants to try it, gets the wrong thing, tries it, and says, well, it didn't work for me. And maybe the issue was not that Manuka honey wouldn't be helpful to them, but they got a very low grade, low quality Manuka honey. And then they discard that as an idea, and they go on suffering with that condition for 5 more years before this kind of information we're talking about tonight really comes to them, and they say, hey, maybe I should give this another look. I might have not really gotten the real deal.
Sure.
So
Worse than that, if it's a medical practitioner or functional medicine practitioner like myself who is not informed, and you just go and buy because it says Manuka honey and it says organic, you think, oh, organic, that's going to be the best. And
yeah,
you're getting a company that's got the inferior quality product, and you're giving your patients something that's not efficacious. And
right,
and so in functional medicine, we typically will use multiple different products simultaneously because they're all foods that we're using primarily. And so if we're not giving the highest quality of a particular product, we're cheating our patients. So it behooves practitioners to get informed on this issue as well. And I'm going to do my job as a practitioner and podcaster to get this information out to as many people as I can so that people can learn about the differences between the qualities of the products that are available and some of the inferior quality products that are out there, not quality, inferior products. So we need to
right.
get people educated. So my one of my mantras that I use on this program is education, not medication. It's
Hmm.
really important that we really get people to become aware. And I'm so thankful you guys are on the program. We're going to kind of come back sometime in the future if that's okay with you guys too, because this is a really robust subject that I think we need to talk about. Um, there's so many other things I want to kind of dive into, but you guys you're in Connecticut, your company's in Connecticut, but you have hives in New Zealand. How many hives do you have there, and how do you keep this operation going?
Yeah, yeah, great. Thanks. Thanks for that question. So our operation in the U.S. is kind of split between my home in Atlanta, Georgia, and Sean's home in Connecticut. Sean and I are almost lifelong friends. We've known each other since our mid-20s in former career, and my family and I moved to New Zealand in 2009, and we discovered Manuka honey, got interested in it, and got into the business when we were living full time in New Zealand between 2009 and 2012. So we moved our family back to Atlanta and launched our fledgling brand at that time. And then I started commuting back and forth. I jokingly on my social media, I've got a little video of my 27-hour commute that I made just about 4 weeks ago to get over to New Zealand. So I go back and forth about 4 times a year. I spend a lot of time in our winter, their summer, overseeing the actual movement of hives and production of the honey. And I have a really great team in New Zealand that I can rely on, mostly beekeepers, a good manager over there that's taking care of the operation and taking care of the beekeepers as they take care of the bees. We've got about 12 to 1,500 hives right now. And we find that to be a pretty good size. We're not looking to grow. There's big corporates over there with tens of thousands of hives. We don't like that model for us. It's not what we want to do. And you alluded to, we're trying to be super high quality, direct to consumer in most cases. We're in a lot of small independent health and wellness stores. We love being in those stores because, as you mentioned earlier, the people who run and own those stores also have a heart for people, and they're doing it because of their want to help, desire to help people. So,
I need to
yeah,
make a point here, if I may. I've been in the health food industry, and I've watched the industry change so dramatically. And I tell people that I believe that there's going to be a real need and a split for the real natural food companies and the conglomerate natural food companies that are just trying to make lots and lots of money, the corporate companies that are just trying to make lots of money and just they don't really have that much emphasis on the quality. It's just like, how can I get less expensive products and get these mass produced? Whereas when you have smaller companies like yourselves, you're more interested in the highest quality so that you can be really on top of your game and service your people. And I really tell people that there's going to be a need for a split. And we're going to have a real natural food industry and the corporate natural food industry, and be able to, for people to be able to see the difference. And these smaller stores are having a difficult time because you have a Whole Foods come in, and they're getting just this massive quantities of products that they're buying. We really need to get back to the roots of the small natural food companies and have a lot of them. And just like, the farmers, we had a lot of farmers here in this country, and the conglomerates now are taking over, and the small family farms are dying out. I think there's an analogy there that's happening in the natural food industry. The small ones are starting to die out, especially in larger cities. We need to find a way to get these companies to come back to life, because I believe that's going to be the difference for people, especially as people learn more about the benefits of natural foods and natural supplements and superfoods to heal the body. So, just a little side note, I wanted to bring that up. But I really wanted to talk a little bit about. It's really interesting that there's research about the benefits of, as we talked about earlier, the Manuka honey able to overcome overcome bacteria that are antibiotic resistant, is what I wanted to say.
Right.
And it has to do with a couple different aspects that are really interesting. And one of them is the what's called the biofilm, which bacteria form this shell, if you want a shell around their bacteria. And it's really interesting that biofilm could harbor not only bacteria, many times there's bacteria and viruses and yeast and parasites even in one biofilm. And that biofilm is like a shield where the antibiotics can't penetrate it. And what's really interesting is that the various types of pathogenic microorganisms, whether it's a bacteria, a virus, a yeast, a fungus, a parasite, within that biofilm, they communicate between each other and they become stronger, and the antibiotics and the medications don't penetrate it.
Right.
But Manuka honey is able to go and penetrate and get into it to do its job to kill off those microorganisms. And that to me is miraculous. That's absolutely amazing when you consider that. So, do you want to comment on that?
Yeah, I've definitely read a lot about that in different studies that I've read where they've talked about the mechanisms of action and how Manuka honey is being effective in its wound care application or in other applications. And the ability of Manuka honey to basically penetrate and kind of break apart, dissipate these biofilms is really pretty incredible. And I think one of the things that researchers are most excited about, there's it's not my personal story, but we have an associate that's going to be presenting at the Maho Midwest. I forget the acronym, but it's their natural products show this weekend. And when I first met him, it was at another show, and he had his daughter with him, who was 8 years old at the time. And she had an eye that was clearly, it was very red. It was infected. She had a real problem with her eye. And I was talking to him about her, and he said, yeah, we've been to, I don't know how many doctors, and, they're trying all these things. Nothing seems to be helping. And I said, well, look, I'm no doctor, but if it were my little girl, I'd try two things. I said, I know the tear duct, which connects with your sinuses, is connected to the eye. I would start the nasal syringe, kind of irrigation, and I would make eye drops and put them in her eye. He got some honey from me at that show. They went home, they tried it. It completely cleared it up. And he came back to me later and he was talking about, you don't know how this has changed her world. It was becoming very difficult for her at school children were starting to ostracize her over, her eye and how she looked and different things. And she's just like completely cleared it up. And when he stands up to present, on to people about Manuka honey, he always tells this story along with 10 other stories he has about different ways his family has benefited and healing. But I think, and that was a biofilm that's what got me on that story. It was a biofilm that the Manuka honey was able to eradicate. So yeah, it really is incredible stuff. People should learn about it. To your point about education, and I just think
Well,
everyone,
can we just talk about? We're running short on time here, and I apologize for interrupting.
Sure.
Okay,
No,
but
no.
can we
Thanks.
talk about some of the ways to deliver? You talked about putting it in an eye drop. Talk about some of the ways to deliver this Manuka honey for home remedies. Just talk about some of those.
Yeah. So for wound care, just directly on a cut, a burn, a mystery rash on your skin. It's sticky. It can be a little bit, but put a bandage loosely over it, and it will. It's amazing the results. It's just a little harder to work with than a cream-based, wound care product. Consuming it just straight off the spoon. You can mix it in tea or coffee. We say don't put it in boiling water. Let your tea steep and cool a little bit, and then mix your honey in, so people consume it daily as an immunity booster and an overall wellness product. But straight off the spoon, if there's anything that you feel coming on, mixing it.
If you're gonna put it in the sinus, if you're gonna put it like a nasal spray, how would you administer that? What would you do that for a home remedy?
Yep, I take a cup of saline solution. So my water, I put my little saline packet in that comes with your neti pot. I'd warm the water up to dilute the honey. So I'd have it warm. I'd put the honey in, and then I'd make sure it's completely dissolved, and then let it cool down to a comfortable temperature, and then administer it. And I use about a half a teaspoon to 1 cup of water with my saline solution. And that seems to work great. For eye drops, I wouldn't recommend just making your own eye drops at home. There's a company that makes a Manuka honey-based eye drop that has run clinical trials on it, and there is published positive results on this. It's Optimel, OPIMEL. You can get them online on Amazon or at various, and I would just go with something like that. Just the sensitivity of the eye. If I didn't have access to it, I would make my own, but I don't feel that comfortable telling people, because you'd have to keep things pretty sterile.
Okay, so yeah, that's good. But if you were going to use it for yourself, what would you do?
I would probably dilute, like again, maybe a half a teaspoon. I'd use our highest activity Manuka honey, so I would use our 830 for something like that, and probably maybe a half a teaspoon to a half a cup of water, and just make sure everything's pretty clean and sterile when I get started, and
Sure.
as I'm keeping up with it. Yeah.
No, that's
And
good.
it's important for these sinus applications or making up, eye drops or whatever. We always use distilled water.
Yes,
Right.
that was my next point. Thanks for bringing that up. I was going to say that, whenever I use any of these applications, I always use, like either reverse osmosis water or distilled water. Distilled water is better because it has nothing in it, and it's going to just basically absorb the things that are in the Manuka honey to be able to deliver it in that solution. Well, that's really good. Boy, I'll tell you what, we've had a lot of good stuff here to talk about today, and you guys have brought a lot of good information. I think I've covered a lot of the things that I wanted to talk about. I know that maybe you can answer this. I know that I've seen that gram-positive bacteria that Manuka is very, very efficacious for, but the gram-negative bacteria, like Pseudomonas and stuff, it's not as efficacious. Have you seen any more research on that?
I know the terms gram positive and gram negative come up a lot in the stuff that I'm reviewing. But I haven't seen anybody particularly delving into gram-negative bacteria and doing more specific studies
Okay.
on that.
Yeah,
No, no.
I've seen some research that's starting to surface to show that it's beneficial for gram negative as well. But what
Okay.
about mixing, for example, Manuka honey with other agents like oregano? I made up a solution for my wife's infection on her leg. I used Manuka honey. I put it on directly, by the way, some, in between the various herbs that I've been using because I wanted to make it moist. And because, the herbs that I was using were, drying up the skin. And so I
Hmm.
used Manuka honey I put in with oregano oil and astragalus and zinc, liquid zinc. And I used probiotics, some
Hmm.
different type of probiotics in a solution. And I mixed it all up and I put also some thyme oil in there as well. And
Mm-hmm.
I made this really nice, and she just spread it on, and it worked absolutely beautifully to take away that cellulitis. But uh, so, are there other things that you've seen efficacious to mix with the Manuka honey? I use silver too, but I put some colloidal silver in there
Okay.
too,
Okay.
and I've seen
Yeah.
studies with colloidal silver too
Hmm. Hmm.
with
Yeah.
Manuka.
Right. Right. I've not done a lot of experimentation with different things. I've done a little bit with things like coconut oil or other things when I've been trying to use it externally and trying to get the consistency a little bit differently. But no, I don't have anything particular to really be able to share with you on other kind of mixtures. I will did think of one other kind of home remedy, and that's using it orally for dental care. And there's some good research out there on
Yeah,
periodontal disease, and
gingivitis. Yep.
gingivitis, and what I like to do is after I floss, I will literally put a little bit of Manuka honey on my toothbrush, and I will brush with Manuka honey, getting it kind of all worked into my gums. And it sounds so counterintuitive, but you rinse that out, and the freshness of your mouth, and yeah, and some of
How
the
much do you put
research.
on the How much do you put on the toothbrush?
Yeah, just a dab, about the same amount as you would put toothpaste. Yeah,
Gotcha.
yeah,
Okay,
yeah.
so is there any research to show that it doesn't cause dental caries? That's what I was interested in.
Yeah, so the research is it's just the opposite. So the research is it's protective against cavities and actually protective against periodontal disease. They did a study where they took patients and after they scraped their gums, there's the euphemistic term for that periodontal process that I had done once many years ago, and it's horrible. And then they put Manuka honey on half the people's gums directly after that application. 6 months later, the Manuka honey sample had much smaller pocket depths on the periodontal test than the sample that didn't have the Manuka honey. So they applied it once right after the procedure, and 6 months later, they still had a difference in measured pocket depth.
Wow,
So
that's awesome. That's awesome.
pretty amazing. Yeah,
Yeah.
yeah.
Sean, do you have any parting words for us or wisdom here?
We're just so thankful that you reached out to us and found us, and we're encouraged by how our customer base responds to us. And as I said earlier, it really does keep us motivated to do what we do, and hoping we continue to be able to spread the good word and help people with the product.
Well, I'm going to spread the good word about your company. Again, the name of the company is Bees and Trees Manuka Honey. How do people get in touch with you? And where's your name of your website?
Yep.
Yeah,
Our website. Yep.
beesandtrees.com is there, and our phone number is also there on the website if you have questions and want to reach out to us. I tend to handle most of the customer service stuff, so you'll get one of the owners when you call us.
Okay, so I know you've got lots of research studies, have citations on there. People can look at the research there. You mentioned that, Mike. We appreciate all that. I want to have you guys back again if you're willing to do that. You guys are awesome. I want to really tell people about your company. I want to get the word out about Manuka. So I'm going to be shouting it from the mountaintop. So you guys, Thank you so much. It's been my privilege. This has been a great opportunity for my listening audience. Folks, this company, Bees and Trees, is the real deal. And I am privileged to know these two gentlemen. And I'm going to be using this myself and for my patients. And I hope that you will too. So thank you so much, my friends. May God bless you, everyone listening to the other side of medicine here today. And by all means, let people know about this program. This is something that is vital to our well-being. Food is the best medicine. God has instilled so many wonderful properties in the foods, and Manuka honey is one of the top superfoods that we have on the planet. You need to be using it on a daily basis. Thanks, my friends. God bless
Thanks very
everyone.
much.
Okay,
Thank
take
you.
care, everybody.
Be
Good
well.
night.
Bye.
Okay, bye-bye.